Hi, everyone. Welcome. I'm Angela Love-Zaranka, Program Director for Lactation Education Resources, and my co-presenter today,
I'm
Sekeita.
Sekeita Lewis-Johnson, the Accredited Provider Program Director for Lactation Education Resources, and welcome today.
So just to give you a little bit of background about who we are, I have been working in peer support in the community for over 30 years, hospital-based as well, 20 years as an IBCLC, and I've been helping people to take the IBLCE exam almost as long as I've been board certified. Sekeita, how about you?
Wow, yeah, I have my background is initially in maternal child nursing with over 25 years as a nurse, but about 14 years as an IBCLC, and I have taken the exam twice. As a matter of fact, I resat in 2018, so I know the nerves that are being provoked right now as you prepare for this exam. So, yes. And I too have a private practice. I see clients in the community as well as multiple other things as a lactation consultant. But yeah, I'm here today to welcome you and help you get prepared.
So if you have any questions for us, please feel free to ask your questions. There is no chat feature in GoToWebinar where y'all can chat with each other, but there is a question box, and you're welcome to drop comments and or questions in that space. If you are participating today from a computer, you can see this blue arrow, which is pointing to where you will find that interface so that you can ask questions or make comments. If you're participating today via a mobile device, take a look here at the bottom and you'll see that green question mark. And so you can find the control panel there and you can ask questions and also type in comments. So we've got a couple of people helping with questions today. One is from our amazing customer support team, Julie Grimes. The other person supporting us today with tech issues is Jill. So Jill Stem is here as well to help with tech issues. And finally, we have someone from our fantastic communications team, Jeanette McCulloch. So we have everyone who are here. We are here to answer any questions that you have. They are going to take a look at the questions, and if they can't answer them, or if they want everybody to hear the answer that we're going to provide, they're going to tag us and let us know, and we're going to flag them and answer them at the end of the session. So now there is a handout for the presentation as well. It is a sample study plan. And so we're going to address what that exactly is, but do take a moment and near the questions box, you should be able to find the box for the handouts. And so please do take a look at the handout. If you are listening to this recording, the handout should be available with the recording as well. So take a look underneath. All right, so let's go ahead and get started. Sekeita, do you want to kick us off here?
Of course, Angela, thank you so much. So, why are we here today? Let's talk about that. We're here so that we can help you get organized and plan for your exam. So, if you are taking the exam in the next 90 days or considering taking the exam within the next year, it's important that you're here, but it's really best to get organized about 60 to 90 days prior to the exam. And that's assuming, I said get organized, that's assuming that there's been some studying going on prior to. So today we're going to walk you through a plan so that hopefully you will feel a little bit more calm and excited about this exam. All right, so we're first going to talk about how to study. And when I say the exam, we're talking about the IBLCE exam. You got it. So let's go. All right, so some advice, and this advice is from our colleagues that have come before you. You want to start making some flashcards. And when I say this, I want to preface this, I should say. If this is something that you've typically done and been successful at, continue to do. If this is something that you haven't done, play around with it. We're not trying to kind of change your ways of studying, but flashcards are incredibly helpful. They're also incredibly helpful because you can actually study with someone who doesn't really have the knowledge can quiz you on them, like some of us used to do back in the day when there were like homemade index cards. And so essentially what I'm saying is, yes, old school things work. So you also want to review the entire course. And I know this says entire, but I got some caveats and we'll talk about them in just a minute. But looking at the detailed content outline and making sure that you've had some education and a firm foundational understanding of those categories. Look over your notes. Huge factor. And when you're looking over your notes, sometimes it's helpful to create your own notes in your own handwriting. You want to relax about memorizing. The core curriculum that's a pretty huge task. And we're not all walking around like computers in our head. Some of us may be, but that's not usual for all of us. So you want to just know the material, read to know the material instead of reading to memorize the material. Okay, all right, so how to know what you know. Again, it's impossible to study. This is a comprehensive, broad-based certification exam. Broad-based, and that is international. So the range of information is virtually limitless. However, you want to just understand that this exam is really testing the knowledge of a competent novice. It's an entry-level exam. It's really designed to separate those who are safe for practice from those who are just not safe working with families. So I hope that puts your mind at a little bit of ease, is that this is an entry level. It is very practice oriented, which means the more experience you have, the better. If you've only had the opportunity to practice, for instance, in one setting, you might want to consider widening your scope of practice by attending support groups or visiting clinics, or really shadowing someone, visiting the WIC clinic, and seeing if you, to see if you could even just observe how different lactation professionals work in different settings. Also available is a pediatrician's office. I would say the NICU, if you're lucky enough to be able to have that experience, but due to the pandemic, you know, there is some constraints on that. But this really is just to say, try to have a broad-based understanding of the different settings that lactation consultants practice in, because again, this is a practice-oriented exam. All right, the Facebook groups. LER has a Facebook group set up for our students for either our lactation consultant training program or our exam review enriched course. These are not open groups. You will need to send a request and answer some questions to be added to the group. But this is a great way to study some of those tricky and sticky questions. I too, even as a practicing clinician at the time, when I went to sit for the exam, I joined the Facebook group and I started to understand some of the nuances of some of the questions. And so these groups are extremely helpful. And so this could be a resource that could A, help you with your study, but B, also help you connect with someone that's in your area that may be sitting for the exam with you. So as I was talking about sitting for the exam and developing study groups are good for some, and study groups can be challenging for others. Personally, myself, I like to study alone and then link up with one study partner. That's a group, I say. So anyways, but try to find a local study group if that's your thing, or a study partner, or a small online group with people with different backgrounds who are truly committed to studying consistently and meeting consistently. You know, sometimes you're, and the reason why I said this about study groups, sometimes you've done all the studying and the person in the group comes in and want to know everything you know, and it kind of throws you off. So just be mindful. But if you don't know anyone taking the exam in your area and would like to meet someone face to face, you could put in a request in our LER IBLCE exam study group on Facebook, and we try to, or if there's someone in there, you know, sometimes you can find luck by linking up with someone to create your own local study group. So let's start over. How to set up your study schedule. You want to use a study guide to plan your strategy. We have a study guide that has been provided in our handout sections that is attached to the recording. You can take a look at that, but you want to plan your time when you're most alert, if that's in the morning, and pick a time when you won't be interrupted. Really depending on your lifestyle, what I say is really negotiate the time that you need for social, for self, for work. You have to be able to figure those things out in a way that is conducive, so that, and realistic, and allows for proper preparation. So really try to be in an area where background noise is kind of dull and not a lot of noise, and those are the perfect perfect environment and settings for studying and retaining information. All right, so what you're looking at right here on this screen is a screenshot of a 30 days handout. And what this does is it provides a list of topics from the IBLCE detailed content outline, and it's activities that you can do to prepare. So note, it's only 30, it's a 30-day plan. And you can start now 60 or 90 days prior to the plan, where you can work on each topic. And it's helpful to know if you spend like 2 to 3 days on topics that you're not very familiar with, that will cut down on the amount of days that you need to spend, or the amount of time that you need to spend on the content that you already know. So pace yourself, start well in advance, and you can plan a few days off, you know, for family obligations. Take a moment for your brain. Again, you don't just want to study, and you're just cramming it in there. You really want to read for understanding and knowledge application, so that when you're asked a question, you'll be able to answer it in a way that, yeah, I know how to translate this knowledge into practice. So this is a visual plan. This looks a little different than like that linear mode. But again, it's a general idea of what a sample study plan could look like. Planning out dates, content, and your study partner can help you remain on track and accountable. Accountability is huge. Accountability is huge in every aspect of our lives. But when this is writing on an exam that costs a certain amount of money, it's important to really say, this is what I did to plan, this is how I organized myself, and this is why I passed the exam. Getting organized, pulling all of your resources together, pulling all of your books, all of your lactation course study materials. Think about what works for you, what has helped you, what was that textbook, that picture, what was it that helped you understand all of the knowledge that you have up until this point. So with that being said, you be prepared is your part of that personal sacrifice that is essential for your success on this exam. Research does show that materials that are learned over a course of period of time is better when you're learning it over a course and it's retained. So One of the things that I learned growing up is proper preparation prevents poor performance. I live by the 5 P's. I teach my kids the 5 P's. And I might have said that real fast, so I'm going to say it again. Proper preparation prevents poor performance. And essentially, that's what we're here to really hope to kind of engage in this conversation so that you are prepared and to help you along the way on how to prepare. All righty. So I talked about gathering your resources. These are the resources and suggestions that that we have here. We have Breastfeeding Answers by Nancy Moorbacher. We have Breastfeeding in Human Lactation by Wambach and Spencer. We have the Breastfeeding Atlas, and we have the core curriculum. And then we have Breastfeeding, a Guide for the Medical Profession. These are all great books. I also do want to plug, because IBLCE really has stated that anything over the past year is fair game, that can be on the exam. So I want to plug the Melanated Mammary Atlas. Also contains a wealth of images. And so really think about which textbook provided the type of explanation, the depth of explanation that you needed to really get your studies together and organized that makes sense for you. And I'm saying that to say these are a lot of books, and so it can be expensive. So I'm not suggesting that you go out and buy every single book, but what I'm suggesting is that you get together with someone who is possibly taking the exam and ask them what worked for you, and not only what worked for you, but why did it work for you, and so that you can understand if it's something that will work for you as well. Now we're going to switch gears, and I'm going to hand it over to Angela while she gets into some of the nitty-gritty of some things to expect about the structure and strategies.
Thanks, Sekeita. So one quick note before I move further, and that is that one of the handouts that we have referenced, the 90-day study guide, is not part of your handouts, but the handout which is included is the one which has a lot of really helpful links to different blog posts that we've written over the past year or two. And so do take a look at those blog posts, and those are going to be really helpful. We will send out the handouts in an email following this webinar, probably within the next 48 to 72 hours. So now we're going to talk about structure and strategies for the exam. So what are the things that you can do in order to feel comfortable and confident and help you to retain some of this information? Well, mnemonics is one thing that you can try. It's using word or first letters of a sentence in order to remember a list of things. So one example of this would be the LATCH system, which was developed to help lactation care providers remember what to look for when assessing a latch. And so L stands for latch, A is audible swallow, T is nipple type, C is for comfort, and H is for the amount of help which is needed. A previous student once suggested that the best way that they remembered the different hormones and which part of the pituitary they come from is PAP for prolactin is generated or created in the anterior pituitary, and OPP for oxytocin is created or found in the posterior pituitary. And so PAP and OP was a way that they found to help them to remember which part of the pituitary generates which hormone. There's also the trick of using the first word of a sentence to jog your memory. So there's an old sentence listed here that you may have learned in a biology class, which can help you to remember the names of the different cranial nerves and the number of the different cranial nerves as well. You may want to make up some of these mnemonics yourself, or you may want to find others who have used mnemonics and find ways that they have utilized in order to remember a list of things. So if there is a list of information that you do need to memorize, remember to divide and conquer. You can subdivide the list into smaller segments. Consider the rule of 3. We can usually remember things more easily in groups of 3. Seems to be the easiest way to remember things. You can also take practice exams. We have several. We have over 500 exam questions in our tool called QBank. It's a wonderful way to help you in your studies. You can practice the questions in tutor mode, and in that way you can learn the rationale behind the answers. Or you can take the exam in test mode to simulate the online testing experience. So I just want to kind of mention 3 ways that you can utilize QBank. There are many ways to utilize QBank, but just 3 general ways that you can do it. One is to go to QBank and turn off tutor mode and set it to untimed. That way you can get a feel for what the questions are like without the pressure of taking the exam in a short amount of time. You can actually discern and choose which category. For example, in the detailed content outline, which I'll show you a picture of in just a minute, in the detailed content outline, all of the information that you need is divided into different topics. And there are 7 different topics, as well as many subcategories underneath each topic. So when you're going into QBank, you can choose how many questions you want from each topic or category from that detailed content outline. And so to start, you may want to just take, let's say, a 50-question test. And at this point, you want to choose all of the categories or topics from that detailed content outline. Later on, if you only want to study one area or test yourself on just one area, let's say pathology, you can do that as well. So once you choose your 50 questions, then you take the test. And you can note that you can mark a question which you're not sure about and you want to review later. At the end of the test, it will tell you which questions you marked, and then you can fix them, take a look at them one more time, and then you can submit for scoring. You can see which questions you got wrong. You can see what you marked, what was right, what was wrong, and where you need to take a deeper dive. You can also take another 50-question test in tutor mode. And then a few days before the exam, you may want to take it in test mode. This will simulate the IBLCE exam, and you can take a 175-question test. So these are some really wonderful resources that we have available through our exam review enriched course. And so you can take a look at our website. I believe we have a link in the handout, and you can see where you can actually sign up and learn more about QBank. So it's important for you to know what is normal. It's important to know the normal weight gain. It's important to know the normal stages of development. And the reason why it's good to know that which is normal, it's because then you will be able to recognize and see when things are abnormal and when there may be a need for an intervention. Study topics, these difficult topics with others, especially those who don't know anything about lactation. So what do I mean here? Let's say you've got a sympathetic person. Let's say you're not at the grocery store, but let's say that you're having, tea with a friend, and you're really, can't quite figure out the anatomy of the breast and kind of how it works. You're really having a hard time. You're studying it several times. You've memorized a few things, but you're not sure. Ask that wonderful friend of yours over a cup of tea if you can explain to them what the anatomy of the breast is like and how it works, right? And hopefully they know nothing about lactation and about breast anatomy and about physiology, because you can then explain it to them in simple terms. If you can explain it to someone in simple terms, then chances are you understand the mechanism because you just taught it to someone else. And so if you can understand the mechanism and if they can comprehend that which you say, then chances are you can check that one off your list and go to the next one. So this is something which is helpful when explaining it. Also, you want to use general terms. Know what those medical terms are, but it's helpful if you can help them to understand by using those general terms. You can also take a look at a picture. And as you're looking at a picture, you can try to identify the different things that are happening in the picture and simplify it for yourself so that you can try to determine what's important in the picture and what isn't important in the picture. Talking through these plans of action can help you to understand the material and to really integrate it into what you're doing. Let's say, for example, what's the difference between mastitis and an abscess? Looking at different pictures of that can help you to discern for yourself the difference between the two for when you do sit the exam. So basic information, the exam consists of 175 questions. Now, some are regular questions, which are related to, some are regular questions, they're multiple choice questions, and some are going to be related to pictures or images. Some are going to be case studies, and the case study type of questions will be where they present you with a scenario, you answer a question, and then they present you with additional information, and then you answer the question based on that new information. So sometimes you may see case studies which build upon each other. Now, questions in the exam are referred to as items. So you may hear me utilize that term throughout this webinar. You will have 4 hours to complete the exam, or 240 minutes. Now, the whole exam, as I mentioned, is multiple choice questions. Each item is made up of a stem, or the actual question, and then several choices, usually 4, but not always. The stem of the item can be phrased as a question, a partial sentence, or a best choice, or a best answer. Now, in this example, what is the stage when copious milk is produced? So if this question is asking about copious milk production, it can be phrased in each one of these 3 ways. What is the stage when copious milk is produced? Or a partial sentence. The onset of copious milk production is called, or a best choice question. What is the best description of the onset of copious milk production? They're all asking about the same concept, just in different formats. And the choices in this example are lactogenesis 1, 2, 3, or 4. So it's important for you to read the stem of the question and answer it mentally. Think about what the correct answer would be. Read the choices. You can usually eliminate the ones that you know are not correct, and so they don't distract you. And then concentrate on differentiating between the choices that are left. Now, tentatively choose your first answer on the list that seems like it's correct. Then compare it to the other selections to that one. If there is a better answer, then select that one and continue on. There may be another answer which could be even better. Do a final check to make sure that you read the question right. If you don't find one that you think is correct, read the stem again carefully to make sure you understood. The perfect answer may not be one of the choices, so choose the best one. And if you're not sure, venture a guess. There's a reason why, and I'll explain that in a few minutes. So again, note all of the information in the stem. It's probably there for a reason. The distractors are in the possible answers, not the stem. Watch for words that change the meaning of what came before in the stem. Words such as but, however, although, even though, while, despite, in spite of, and regardless of. Watch the context of the question as well. An answer could be correct, but for this situation, it's not correct. So do watch that context. Now your choices are going to fall into 3 categories: sophisticated distractors and unsophisticated distractors, which is actually 2 categories. Sorry. An unsophisticated distractor is something easy that you might know anyway, or something that is obviously wrong. And then of course there's the correct answer. Oh, that's the 3rd one. There we go. So there are going to be 3 choices to eliminate: those sophisticated distractors, the unsophisticated distractors, and the correct answer is the one that you want to choose. Sekeita, what else about exam prep and taking the exam would you like to share with everybody today?
Yes, excuse me. I love talking about this first impressions because how many of us have taken a test, selected the correct answer, was like, I don't know, I'm gonna change it. You changed it, only to later find out that you had the correct answer all along. Don't that drive you crazy? Like, for real, like, you know, that is one of the things that as a kid, I remember missing. For instance, if you're like me, type A, missing a point was like when you knew you had the answer correctly. That is a hurtful feeling. So remember, Angela talked about reading the stem of the question read the stem all the way through, and then each possible answer all the way through and indicate your answer. And the reason I'm stressing that is because, in all honesty and in reality, social media and all of the other strengths, our attention spans are just a little bit smaller, and we have the this whole thing, we got to move fast and like we're almost like computers. No, this is an exam where you want to make sure you don't skip any words. You don't want to skim it. You want to read it. You want to read the question for what it is. But when you're reading that question, it's important to not read more into the question that's really there. The questions are not designed to trick you. You really just want to read the question and use the options themselves to provide you some hints about things that you either need to know or like that's giving you a pause. The other thing you want to do is watch for scenarios that or questions that include or answers that include always, because rarely is there a situation in lactation that falls into an always category. So usually most of those times, always is just not the answer. There should not be any all of the above choices for answers. Those are generally questions that or answers that don't really show that you know the material, okay? If you get to a question that you absolutely have no idea, what is this question asking me? Make a guess, flag it, and then move on, okay? And you'll be, with a computer-based test, you'll be able to go back, provided you have enough time. The reason why it's important to make a guess is that you don't want to just skip over it. You want to answer the questions, because what if you don't have enough time? So your best guess, flag it, and then you can go on to the next. You can go back once you've completed the other questions. So remember I said guess. There is no penalty for guessing. Really and truly, there's usually 4 answers. So that means you got 25% chance of getting it right. And if you can eliminate another choice, then that increases your chances and your odds of getting it right, right? So if you are uncertain, again, I already said eliminate, Angela, I believe said eliminate the options that you know are definitely wrong, flag it, all right? Now, if you have no idea of the answer, check for like look-alike options. Check for the most inclusive option, the options that contains the most information. Think about what it might be similar to, anything that you've seen or read that was sort of the same, related to it, and then see if you can make an educated guess. If one of the options is totally unfamiliar, be real suspicious. Something that you've never ever heard of before or seen, have never heard of before or seen, may be totally unrelated to the STEM. This is likely one of those distractors that Angela talked about. And lastly, some exam statisticians recommend setting up a predetermined strategy for guessing on the questions that you are clueless about, which means after eliminating the obviously wrong answers, then always select the first option or the last option. It's up to you. But if you always select the answer in the same position, then you increase your odds that your guess will be randomly correct. Now, Angela discussed pictures, items. About half of the questions will be based on pictures. With pictures questions, you might have to either define a diagnosis or condition or distinguish between normal and abnormal. And as Angela spoke about earlier today, if you know the normals, then you can obviously pick out the abnormal. Key things are knowing the development and determining a child's age by their posture, their size, or their behavior. What are they doing in the picture? So for instance, this little one is just sitting up. She seems surprised about something, not sure what, but if you had to think about the fact that developmentally she is sitting up, what age would that be? And she's actually focused on something. What do you think, or what does the literature say this little age person to be? What does it say? Is she 4 months, 6 months, 9 months, that sort of thing? You want to determine a problem sometimes. If there's a picture, for instance, and there's like a compression stripe on the nipple due to some type of shadow latch, you want to be able to determine that that compression stripe probably is due to what I just said, a shallow latch. The other picture, you can see there's asymmetrical breast. This picture I could think of a couple questions that would be able to really get to some understanding that these are asymmetrical breasts. So think about a picture may be used also in a case study where you're asked to recommend a care plan and decide what you would recommend first or next. But think about that. I said first. What would be the first recommendation? Now, in some instances, really stress, your first is always reassurance. It's always reassurance. And I'm saying that to say that when you're thinking about what is your first response, a lot of folks think about, I got to touch, I got to do all this stuff, I got to do something, right? Sometimes your first response is that counseling piece, that extra additional 5 hours now that you've had to take. You really want to think about that, all right? All right, so definitely take a look at these pictures. Definitely understand why you read the question first and then look at the picture so you can pick out the important features faster. Reason being is because if you look at this picture first, the first picture is almost like startling, right? And you, in your mind, you're already thinking of potentially what this is. You've already done some checks and you haven't even read the question. The question probably is, what color is that pillow next to that breast? No, it won't be that type of question, but you get the point. You also want to look at each quadrant of the picture. You want to look for cues. And if the answer is not immediately obvious to you, you really want to just take a minute, pause, again, answer it and move on. But the picture should be familiar. The images should, they may not be obvious, but they should start to get your mind going. So the images may not be as obvious as this picture on the top. This picture on the top is massive mastitis. A more likely image is the redness seen just up under the nipple on the image that's up under it, that's a little bit more subtle. So again, it helps to read the questions first. And I do want to comment that the images are not perfect. Some images may appear dated, not sure. Some images may not seem as clear. You know, you really want to think about, what is this picture asking in the context of what I'm looking at, and so, and the context of practice as well. So think about those things. Let's see, remember that IBLCE is comprised of IBCLCs, so pictures come from all places. They have thoroughly reviewed the question image to ensure that all of the information is there for you to answer the question, okay? And on a final note, there may be images that are of lighter skin tones. Hopefully that'll be changing where we'll start to see, and you might come back and tell us after you take the exam, yeah, this exam was a little different. But many of the lactation consultants who have taken clinical pictures and shared them with IBCLC took them of people who are white, and that's where they get their pictures from, okay? So you can consider sharing some of your images with IBLCE if you would like, if you have them for representation, or to LER, whichever one. But yeah, that could be just letting you know and preparing you for what you may see. All right, remember I said I talked about reading too much into the question. These are some of the common mistakes that are made. Take the question at face value. as I already said. The other thing, there's a saying that says, don't look for zebras in New York City's Central Park. Look for the most common likely answer. In Central Park, you are most likely to see a horse and not a zebra. So that was the point of that phrase. Watch for qualifiers. I've already said that, but I only talked about always. There's other qualifiers. There's always, never, least likely, most likely, the first thing that you would do, or best choice. Think about it. And particularly with the best choice response, because sometimes when you get a question that's asking you for the best choice, sometimes that can mean that it's arguably another choice, but which one is the best one? So that's why we're saying watch out for that. If your mind goes blank, remember, just answer the question and keep it moving. Don't panic, take a deep breath and go back. When you mark it for review and then go back. The other last thing I want to say is for those who are advanced practice nurses, midwives, physicians, any advanced practice providers, remember the questions are designed for IBCLCs. And it's tricky when you've been trained and been practicing as a midwife or nurse practitioner or physician for many years. So I'm just going to leave it there. But just remember, this is the management, the clinical management of lactation related things. And so really kind of go in it with that frame of thought. That could be helpful. All right, so I think I have talked a whole bunch about what to do when you get stuck. You just take a deep breath. You want to think of real situations like the one in the question. Common sense also. We've talked a lot about reading the stem, looking for those clues in the adjectives or qualifiers. Don't choose the familiar answer just because you're happy to see something that you're familiar with. You want to choose it because it's the right answer. And if it's not, try to tease out the clues from the other choices. Think of other possible answers that are not on the list and then move on and keep going. And I can't stress that enough. And so that's why this is a little bit redundant in the fact that if you pause, take a breath, flag it, it might be your mind just went blank. You can probably retrieve that knowledge once you go on to a few more questions and be like, that's the question. And then you go back and you answer it. So I hope this session has been clearly helpful in some of the strategies that could help you pass your exam. Angela, I'm going back to you now.
Thanks, Sekeita. Okay, great. Now I'm going to talk about exam content. And this is one of my favorite things to talk about. And the reason why is because not only am I a geek about lactation and all things that, but I also served on both on the IBLCE exam board, as well as on their exam development committee. And so I do probably have a deeper knowledge of the exam. And so just want to, provide you with some of those strategies as well as some reassurance. So the IBLCE exam is a reference-based exam. Well, what does that mean? It means it's based on the current medical literature. It's based on literature such as current textbooks. So if you take a look at the compendium of research that has been validated, peer-reviewed, and then the pipeline over the past few years, that is going to be included, as well as ABM protocols. So things which are not included are things such as unvalidated research. That means that additional study has not been done to support the conclusions, or additional research did not support the original study. Anecdotal materials, verbal statements, websites, and even conference presentations. The only things that are written in a peer-reviewed journal are included. Textbooks such as Breastfeeding and Human Lactation, Breastfeeding, a Guide for the Medical Profession, the core curriculum for the lactation practice, those things are evidence-based or evidence-informed textbooks. And it's important to think about when you're actually sitting for the exam or you're reading and studying these materials, try not to go down a rabbit hole of ifs and buts. or the one-off presentation. If you hear yourself saying when you're looking at an exam question, well, I knew this one case where, you're going down that rabbit hole. So you want to take a look at what is most likely to occur. So the exam covers all topics, all of these topics as they relate to breastfeeding and lactation. So you can go to the IBLCE website and to the documents section and access the detailed content outline. You do want to make sure that it's the detailed content outline for 2023. Now, even though it is 2022, take a look at the 2023 document. And the reason why is because there were only minor changes. Julie, who's on the call today, did a deep dive and noticed that they just sort of reclassified things a little bit. But all of the topics and all of the content, it's still there and it's relevant. You may even want to print it out a little bit. I know some groups of exam candidates have created a Google Doc and they use the detailed content outline as their outline, and then they actually list different things underneath each one of the areas of the detailed content outline. And they gave everyone access to it. It was a Google Doc, and it was very funny. I ran into someone prior to the exam who had actually printed the document out. It was many pages. They printed the document out and they had it in their conference bag. And so they were pulling it out and studying it, in between the conference sessions. So that was a very innovative way to get those last few days, get that last bit of studying done right before the exam. So now this information should provide you with a little bit of reassurance. I created these tables from the information from IBLCE, public information from their test analysis report. So they published this broad overview on exam performance a few months after the previous exam. So this information I wanted to show you is based on performance by cohort. So one thing to notice is first-time people passed. 81% passed in 2019 in the April exam cohort, and 72% passed in October. So what's the difference between April and October? Well, the difference is that in April, the exam is only offered in English. And most of the people who take that exam take the exam in the language in which is their mother tongue. In October, they too will also take the exam in English, but the translations are available in the October exam cohort. And so that's the reason why you may see that difference. Another piece of it is that the reason why language matters is that there may be some relevant textbooks which have not been translated into that language in which the exam is being provided. Therefore, exam candidates, while they can take it in their mother tongue, they may not have the textbooks and all the resources that they need by which to study for the exam, which is why the October cohort could possibly be that people in October don't necessarily score as well as they did in April. So also take a look at the recertification by exam group and note that that data is a little bit skewed. And the reason why is in 2019, those were people who were taking the exam at the 30 and 35 year mark. There were only 14 of them and 100% of them passed. So regardless, that cohort is skewed a little bit. They scored best on the exam, but it doesn't, because it's the reason why is they've taken that exam more than once. Some of those people have taken the exam like 4 and 5 or 6 times. And so the questions now, they're not going to be the same as they were when they first sat the exam, but these people have been around for a minute and they are probably the lactation educators that we all know and have studied under. So as most mentors will tell you, the nice thing about having students is that they keep you fresh and on your toes regarding the latest evidence. So I know I enjoy my interns and students as well because they keep me on my toes. So taking a look again at the exam results from candidates from 2 consecutive years, you can see how these topics, each one of the different topics, seem to give the most difficulty. So take a look at the topics that scored below 75%. Immunology and infectious disease. Also notice that there's growth parameters and developmental milestones. So now there was a slight shift with pathology, which dropped over these 2 years. Pharmacology and toxicology improved. Psychology, sociology, and anthropology, which declined. And interpretation of research improved. So these are the areas where they identified it over these 2 years. And I know that the exam topics are slightly different than in the current detailed content outline, but I think you can closely approximate which areas of the exam candidates seem to have not performed as well. And so if you're taking a look at, oh my goodness, what do I study? Consider something like this, where historically people have not scored as well on the exam. These are the questions and the areas that you may want to spend a little bit more time. Also note, some people will ask, well, what should I study? So not only what others have not performed as well on, but also in the detailed content outline, there should be a number which will give you an idea of how many items are going to be in that section of the exam. For example, on pathology. So it should give you a range of the number of items which will be on the IBLCE exam in that topic. And so that can also give you another idea. For example, I believe in, just off from memory, I believe that, what is medications? The pharmacology, sorry, the pharmacology subject. I believe there's only like anywhere from 5 to 10 items on pharmacology, whereas clinical skills usually is going to have something like 30 plus. And so if you have to decide where to focus your efforts, you may want to focus your efforts on those areas of the detailed content outline, which have more items that could be on the exam. The exam also covers each one of these chronological periods from preconception to toddler. The majority of questions are clustered around the early newborn timeframe. So these are the test scores for chronological stages. While you can see that there are some areas of improvement, such as in the 15 to 28 day group, and decline, such as in the prenatal setting, it appears that most candidates are very good at the first few days, but seem to have more difficulty with older babies. So you can find ways for you to study. You can find or ask for pictures of babies at stages that you currently don't work with and sort of quiz yourself. Stanford University has a library. The Breastfeeding Atlas and the Melanated Mammary Atlas are all opportunities for you to take a look to see if you can determine, actually not the Melanated Mammary Atlas, that's only mammaries, it's not babies, but you can take a look to see what are the different ages and stages and how to know the difference between a baby who is sitting up with ease and a baby who's sitting up just barely. So it's also helpful if you have any access to either providing support through a parent support group, or if there are any virtual support groups that you can be a guest. It's sometimes helpful if you can actually see those babies as well and kind of listen to the parent stories and to determine what that baby may be going through at that age so that you can familiarize yourself a little bit better. So remember, don't panic. You may be asking yourself, what should I know that I don't know that may be on the exam and I just don't know it? You will be prepared. Believe in yourself. Haven't the families that you've been working with benefited from your information? You really want to pace yourself. Take your vocabulary words wherever you go. Make sure that you utilize these little pockets of unexpected time to study. Do watch yourself for signs of excessive stress. Symptoms can include mental, social, and physical problems. Mental stress can show up as being forgetful or confused or agitated or just a little spacey. Social stress can show up as being irritable, argumentative, or withdrawn. Stress can show up in physical problems such as cold sores, bladder infections, eczema, GI upset, or catching a cold. Do what you need to do in order to reduce your stress. Thank you all for listening today. Okay, Sekeita, what questions do we have?
We have some good ones, Angela. some actually, interesting ones, I would say. So the first question we have is, are you able to take notes on the questions you're unsure about? Now, I am going to say that Angela and I, first of all, I'm going to do a plug on our exam prep. We have been keeping a close eye on some of the changes that have occurred as it relates to the pandemic. And so what that means is that if you are doing live proctoring on a computer, you're not allowed to have anything around you, okay? Nothing. Like, you actually have to take your computer and be able, or your webcam, and be able to show that there's nothing. Now, in the individual testing centers, I think there used to be a time when you could take notes, but I don't believe that you're able to. Now, I am just stating that from a standpoint of, since the pandemic shifted, there's been lots of shifts in rules, and it can shift based on the numbers. And so stay tuned. But that is an awesome question. And yeah. Angela, I'm going to ask this question of you, and I have some thoughts on it too, but the ABM protocol for mastitis has recently changed, and it's way different than advice given in other previously published evidence-based text. Any idea which treatment method would be included on the exam? With ABM supersede previously published text, even if they are current revisions?
That's a great question. Thank you very much for bringing that forward. I will say, so for the exam, which is coming up, my assumption is that it's going to be based on the previous. And here's the reason why. The reason why is because this exam was created before that guidance was released. And part of the exam process is the translation of the exam. And IBLCE is quite rigorous in the translation of the exam, in that they translate it from English into that language. Then they have a separate person translate it back from that language back into English. And then there is a comparison of the two versions to ensure that the words which are utilized are valid in an international context, meaning if we're talking about French, the French language, there are different colloquialisms and such based on the country in which French is being spoken. Therefore, there's a translation and a back translation. All of that process takes time. So I can be relatively confident, although I do not know, let's be very clear, I am relatively confident that the ABM protocol is probably not going to be on the exam, which will be in September of 2022. So that is one aspect of it. As far as whether or not it will be in the 2023 exams, that would be a really good question. Again, the exam is usually created well in advance of when it is given. And therefore, I would think that it may take a little bit of time before that is fully integrated into the IBLCE exam. And the reason why is similar to what I said earlier when I mentioned that they don't have textbooks and references which have been translated into the languages in which the IBLCE exam is being provided. And therefore, if the protocol, the ABM protocol, which is an excellent way to study for the exam, the ABM protocol, though, if it has not been translated into multiple languages in which the IBLCE exam is being given, then there may be a slight delay in the actual inclusion of the information from that into the exam in which you are going to take. So just be mindful of that as you're studying, that at least for this year, and I'm being very careful to couch it in this year, that in this year and the exam that you're about to take, chances are that new ABM protocol on mastitis will not be included, and the mastitis spectrum will not be included. How is that, Sekeita? Did I cover it?
You did cover it. And I just, the only thing I thought about with this question is that, remember, this is an entry-level exam. Remember that, like, you are not expected to know a protocol for like this is, the questions won't be as elaborate. Now, in clinical practice, can you translate certain aspects of it? Absolutely. Those are the types of questions, but the actual protocol itself. But yes, that was a great question. I love that. But just keep in mind, again, it is entry level. Yes. And as Angela said, actually, I went to look at what languages had it already been translated in, and the only one that I see is English right now. Is that it's only in English at this point. And so, yeah.
Thank you for checking. Yes, someone asked if that has it been translated, and not yet. And then someone else asked, based on these protocols, if if you should study the ABM protocols. The nice thing about them is that they are international. They have been translated. They utilize a multidisciplinary group of providers from around the world. Therefore, the protocols are good ones to study. And you can, and if you want to know more information, it's all referenced. And so you can find out more information. Some of the protocols are more than 5 years old. However, they're still valid. And I say 5 years old because a lot of times in research, we like to try to update things, any sort of, guidance, any sort of clinical practice guidance or protocols. We like to update them about every 5 years. Remember that the ABM is a volunteer organization, and doing a revision of a protocol is a heavy lift. And so even if it's a little older than 5 years old, please do use it. I would suggest one little note. I would suggest that you download, if possible, download the protocols that you would like to study. And the reason why is, I don't know how many times, Sekeita, I have gone and I said, oh, ABM has a protocol on that, and I'll navigate to the website and it's under revision, therefore it's not on the website. And I just go, oh, I wish I would have downloaded it. So do download those protocols so that you have them. And especially if your internet is something which isn't always there, then it's helpful if you can have them downloaded and have them in a place where you can study them.
Yeah, great advice, Angela. Thank you. There is a question that says, do you have tips for people taking the exam in English, but it's not their mother tongue?
So I would say, do you have any suggestions, Sekeita, or is that one mine?
No, go ahead. Go ahead.
So I would say for that, do study as much as you can in English. And the reason why is because those are some of the common medical terms that you're going to run into. If your mother tongue is a Latin derivative, then there's a possibility that you can probably figure out the different words based on that commonality of the language. But do try to study as much as you can in English, especially if there could be one textbook that you're able to obtain that you can actually take a look at and read in English. That would be something which would be helpful. Also, reading the ABM protocols in English, that would be helpful as well. So do what you can to study as much as you can in English, and go from there.
All right, there was a question, and I don't want to, I want to acknowledge it, but also say that there's an answer that's been posted, and it's about the extra time needed. And I see Julie is on it and has already answered it. So so the other question, the next question I'll move on to, is it more?
Well, no, go ahead and read that one. I think that's
okay.
For the recording.
So yeah, so it says, hi, English is my second language. Am I allowed to take a regular dictionary so I can use it during the exam? How can I apply for the extra time for my IBLCE test? And the answer is, you will not be able to bring in a dictionary, but they can and will allow 30 minutes extra time if English is not your native language. However, you have to have approval for that. So you can contact them at IBLCE at IBLCE.org to find out how to get this accommodation. All right. You're welcome. There's a question, and I'm gonna say we're winding down, but yeah, there's this last question. Is it more helpful to read and study notes or take a lot of QBank questions? Okay, I'm gonna take a stab at this. I think all three. I think it's important to read the information. Again, read for understanding, not just reading, but read like you're reading a novel. That's how I read, try to read articles. Read like you're reading a novel, and that helps you to retain. The other thing is to take notes while you're reading. Taking notes in your own handwriting helps you to retain the information, and not just that you're remembering it. It is there. It somehow gets just a part of, I like to say, a part of your brain DNA, that knowledge that you're reading, right? But when we're talking about these things, how do you know that you can translate the knowledge? And that is through doing questions. So you've read, you've written down, you've taken your notes, and now it's time to do the questions. So I think that there's always a system for people. How you work that system is a very individual thing. But again, and also taking courses. That's what I was going to say. So you read, and then you have the courses from the experts who will usually have pearls of knowledge that is sometimes not as clear. I always say, even when I'm learning from the experts, I get to review lots of wonderful lessons. And sometimes a colleague will say something and I'll be like, I'm writing that down because that was an aha moment. Like, I will understand this from now on because this is how it was explained to me. I'm going to tell you, I had an aha moment when we're talking about the international code. I remember telling Angela, like, this is the first time I've understood this. And so, we all learn from one another. And so really doing the lessons from the experts also will give you that extra edge in addition to all of your other preparation and things that you've done and are going to do.
And I can even distill that further. The nice thing about our exam review enriched course is that it has 32 different webcasts on topics in the detailed content outline. And so there are experts who actually teach those. So it's almost like that sort of condensed information that you need, either on medications, on slow weight gain, on different topics. And so you can actually go there and we have worksheets in there as well. And the nice thing about the worksheets is that the first one is blank, but then we also give you the answers. And so you can print off the worksheet and actually work on them a little bit, see if you've got it, and then check your answers so that then you can make sure that you covered everything. And so we provide you with as many tools as possible, depending upon your study style, what may work best for you. So we try to cover as much as we possibly can. Anything else, Sekeita? Any other questions in
No,
there?
that was it. I think we did a real good job of explaining.
I do too. And we will send out those handouts, so do look for them in the next few days. Thank you very much for participating today and all those great questions.
Yes, good luck on your preparation and studying. If you have any questions in addition to this recording, you can always reach out to us.
Absolutely. Support@lactationtraining.com. Have a great
Yes.
rest of your day.
Enjoy. Bye-bye.